Hey everybody, how are you? Dr. Sullivan here. We are together for another I Care for Your Brain lecture on Facebook. We are here to accomplish two goals. We are here for brain education and brain health empowerment. We want to make you so strong and confident in your ability to take good care of your brain that you just feel like you are in such wonderful control of this very important part of your health. Tonight we are going to be talking about anxiety, that terrible feeling that we all get from time to time. And for some folks, it's not something that comes and goes and is episodic. It's something that is very, very distressing and feels incredibly disabling to people's lives. So why does this matter? Well, it matters because it reduces people's quality of life. It absolutely exacerbates cognitive symptoms. And so I've often talked to you about this layered cake metaphor, that you may have cognitive problems, say with memory or with word finding or attention, that is due to one layer that maybe is nothing that we can do about it. You've had a stroke and unfortunately there is some irreversible damage. Well, very few people that I've ever seen in my whole career as a neuropsychologist just have one layer. There's almost always multiple layers to the cake. And my whole approach clinically is how can we remove some of these layers so that way the intensity of the anxiety, the intensity of the memory problems, the intensity of the attention problems are not as severe as they were before or really could be. So this is important because we know that when mood disorders, including anxiety, go untreated, they absolutely get worse and they will disable the person more and more. And this is really because of a symptom called avoidance. And what this really is that our very natural tendency when we are anxious and scared and fearful is to isolate and to make our world controllable and to make our world small. But the problem is this actually makes you feel more overwhelmed in the long term, more afraid to get out and do things. And this is how people develop things like agoraphobia, which is basically becoming a prisoner in your own home and not really feeling like you can handle the challenges of getting out and being social, getting out and working. And over time, this little tiny island that you're living on becomes smaller and smaller and smaller and smaller. And the truth is that's the recipe for depression because we are not connected socially to other people. So it's absolutely worth our while to spend some time tonight talking about this. So like I was saying before, we all experience anxiety, right? Imagine right now that I told you tomorrow you have to go get 2 surprise root canals. Well, everyone listening is going to be like, oh my gosh, that's going to be terrible. The smells, I'm going to be in pain. It's going to be expensive, right? That is normal anxiety, okay? You have a test coming up tomorrow. You have a colonoscopy a couple weeks from now. It's very normal to feel anxiety about that. That's not what we're talking about. That's adaptive. That keeps us on our toes, helps us self-soothe so that way we can get back to our baseline. What I'm talking about now is more like an anxiety disorder. So this is anxiety that is so intense that it literally feels like torture to be inside your own self, to be inside your own skin. And really it gets worse and worse over time, and it becomes more and more disabling over time. And this is why in some ways it's really important to almost have like an intervention about anxiety, because the person themselves can sometimes actually feel that by limiting their world, they are managing the anxiety more. But the truth is, I'm telling you, it backfires. And what happens is down the road, you actually find yourself more and more anxious, in part because you're out of practice. You're not used to dealing with people. You're not used to the overwhelming sounds at the mall. So when we get to talking about treatment and what you need to do, you really have to understand how avoidance is the core problem that we're talking about. So anxiety disorders are very common. In the US, we think about 3 million people have them, and it really does go across all age groups, but really in older adults over the age of 65, we actually see a bump. And we think about 15 to 20% of older adults would meet criteria for an anxiety disorder. A lot of anxiety in older adults is actually related to medical health, to physical health. And what the research tells us is it's really related to having to face our own mortality and a sense of vulnerability within your own body. When your body is strong and able, it's very easy to feel that same way in your mindset. When you are getting older, or when you have been through something like a stroke, or you have a movement disorder like essential tremor or Parkinson's disease, it's so easy to not feel like you are strong, and that you could take care of yourself, and that you are steady on your feet, and that you're safe in your environment, because your body just isn't, the brain and the body are having a hard time connecting. So when we talk about anxiety, there's actually a range of anxiety disorders. So you surely have heard of some of these. So generalized anxiety disorder is what we're going to focus on tonight, because probably most of you would, if we had to say classify you in one of these disorders, generalized anxiety disorder is probably the most common, but panic disorder, obsessive compulsive disorder, post-traumatic stress disorder, separation anxiety, specific phobias, like people having an irrational fear of frogs, for example, that would classify under an anxiety disorder. Then, of course, there is this adjustment disorder with anxious mood, which is really kind of more of a temporary feeling of anxiety, and it's really focused on something specific that happened to the person. So of course anxiety varies in severity, and how we really judge this is by two measures. The first one is how much distress does it cause the person? How much does it bother you? And the other one is the level of impact it has on your everyday life. Does it keep you from doing the things that you need to do every day to maintain your responsibilities and keep yourself happy and healthy? So working, being a mom, being able to go to your church gatherings in a way that you want. So we really look at the degree of impairment as clues to how bad someone's anxiety disorder is. So let's just go over some of the criteria for this generalized anxiety disorder, because I want you to be thinking if this is something that fits you or someone you love. So how we define it is that it's excessive anxiety and worry that occurs for more days than not over a period of at least 6 months. And really how you can think of it is that it's a free-floating anxiety. It basically gets focused on one thing. Okay, let's just say it's, oh my goodness, I feel my heart is starting to beat fast. Oh gosh, and this is, let's say it's part of a kind of an anxiety attack kind of a thing. Oh my gosh, maybe I'm having a heart attack. Well, later that same day, we get a letter in the mail from the IRS, and the first thing we think when we see it is, oh my gosh, maybe I forgot to pay my taxes for a few years, and this is going to be a big fine, and they're going to take away my house. Later that same night, your spouse doesn't come home on time, and you're immediately thinking, oh my gosh, they're out having an affair. It basically just jumps all around these little rocks in the pond of anxiety, and it never really stays focused on one thing. The person themselves finds it very hard to control the worry. They don't want to feel worried, but it just feels like it is the truth. It is reality that things are very threatening. And in a minute, when we peel back some of the layers on anxiety disorder, we're going to talk about something called cognitive distortions, which are fascinating and really at the heart of anxiety. And it's basically all of us thinking that we are fortune tellers, that we have a crystal ball in front of us, and that we really know what's happening, and we really think we can predict the future. So I'm going to point some of those out to you, and we're going to actually do an exercise at the end of this talk where I'm going to help you start to keep kind of a journal so you can be recognizing when you are doing this thing called cognitive distortion. So let's go over those symptoms. So what they talk about is you have to have at least 3 of the following 6 symptoms to meet criteria. So the idea is on more days than not, you are feeling irritable, you have tension in your body, it is hard to either fall asleep or stay asleep, it is a feeling of being kind of keyed up, on edge, restless, feeling very easily fatigued, and having difficulty concentrating or feeling like your mind suddenly goes blank. And of course, tonight what we're going to be talking about is exactly that in a lot of detail. So what you have to understand for this to be a clinically diagnosable disorder is that it's not due to something else that's going on with the person. So thyroid disorders are actually a great example here, especially when thyroid hormones are high, hyperthyroidism, or something like Hashimoto's thyroiditis, where the thyroid hormones are very, very erratic, and even within the course of a few days, you can go down, you can be up, you can be stable, you can be back up. Thyroid hormone is very much related to anxiety, and there's so many, this is part of why I love being a neuropsychologist, is because there are many times where it is a medical issue, it's a biological issue, and because there is so much stigma with mental health and things like anxiety, people often get invalidated and frankly blown off when they go to their doctor and talk about these things. Oh, you know, you've been through a divorce, you know, these things happen. And I think the truth is it happens more to women in my experience. But anyway, so you have to make sure it's not due to, you know, a thyroid issue or a drug someone is taking or something like that. So most people who have generalized anxiety really do have three symptom clusters. So the first one, of course, is the emotions. So the worry, that feeling of dread, kind of feeling like helpless to the thoughts, like you can't help it, but you just kind of see threat and disaster everywhere you turn. The other one, of course, is our behavior. So feeling like very keyed up, very overwhelmed, feeling like we can't settle down, we can't relax, very, very hard to relax. And then many of us with anxiety really do suffer with physical symptoms. And if you ever want to read a book about this, there's a great book called The Body Keeps the Score, which is all about how psychological trauma and anxiety very often lives in the body, and this is because of that avoidance, the enemy with the capital A, meaning that we try to push the thoughts so hard out of our mind that they have to go somewhere, and with all that suppression, they go on in the body. So this is why anxiety so often results in stomach ache, things like diarrhea, things like headache, muscle tension, feeling like your back and your shoulders are just absolutely killing you, because people work so hard to keep the scary thoughts out of their mind, but where are they going to go? They have to live somewhere. So really, we express so much of our anxiety through our body. The other thing that can happen is that the anxious thoughts get pushed really far out of our mind consciously, but unconsciously, because of the nature of anxiety and the part of the brain that it affects called the amygdala, which is a very, very old part of the brain that is a threat detector. We are constantly, when we're anxious, scanning the environment to see what is potentially threatening us. And this takes up valuable real estate in our mind. And this is how we're going to transition into talking about the cognitive symptoms of anxiety. So what we know when you look at the scientific literature is that anxiety disorders absolutely have a cognitive component, and how this really gets played out is in two things: an area called selective attention and working memory. Now, here's your neuropsychology lesson for the day. These symptoms can feel to you like a memory problem, but I'm going to explain it to you as best I can to help you realize it's really an attention problem. The problem is not actually being able to concentrate enough to make the memory in the first place. So, of course, it was never set up. It's not there. It's not that you're forgetting it once you learned it. It's that you couldn't settle down enough to learn it in the first place. So let's talk about selective attention. So what this really is basically the inability to filter out information. So we are so incredibly bombarded by sounds, by color, by words, by concepts, by emotions, by stress. It's unbelievable. And what the human brain is so amazing at doing when it is healthy is filtering these things out for us on a very unconscious level. This is important. This is not important. This has meaning, this doesn't have meaning. Ignore all of this, but just focus on this one thing. So this is like being in a lecture in a classroom and really just being able to focus on what the professor is saying, ignoring the gum chewing that's going on over here, ignoring the service dog that's in the first row, ignoring the clock that's telling you how much time you have. Your brain is really able to focus on what's important. This is one of the main things that happens when someone has any type of brain injury, is that this filtering system does not work as good, and people feel unbelievably overwhelmed because their brain is exhausting itself to keep up. So with anxiety disorders, the problem is we are on the lookout for this threat so much. What could hurt me? What could potentially harm me? That everything feels like it's important, and you just cannot pay attention to multiple things at once. It's just not possible. In fact, I find this very interesting. We have about 7 slots, you can think of it that way, in our brain. And you guys remember when telephone numbers were just 7 digits, so it was the 3 in the front and then the 4, right? You actually could remember quite a few people's phone numbers. But then they started to add in area codes, and then they started, like I remember in New Jersey where I grew up, we went from 1 area code and then we had 3 area codes all of a sudden. Once you add in those extra 3 area codes, forget it. It's very, very hard because we are very good at 7 things, give or take. Some people are good at 5, some people are great at 8 or 9, but on average, human beings can take on about 7 pieces of information. If you are already filled up in your brain with 6 of those slots are, what is this person doing? Can I trust this person? Oh, was that person actually, making a snarky comment to me? Is this food going to make my stomach upset? Are my lights going to be shut off? If you're just pinging all around with anxiety, you're literally filling up your mind, your 7 slots, with internal worry and concern. This makes your ability to focus on something at hand about this big. So everything else that's going on outside that tiny, tiny little telescope is not sticking. It's literally like a sieve. It's a butterfly net, and things are just flying through. Okay, so that's your main problem with anxiety. The second one is called working memory, and this is basically like a little sketch pad in your mind that when people, phone number, we'll stick with that example. When someone says that phone number to you real quick, you know how in your mind you repeat it like 269 534 2715, okay? That ability to rework those numbers over and over until you get to your phone and you can punch it in, that's working memory, okay? When somebody meets you at a party and they say, hi, my name is Karen Sullivan, and I remember I met you at the grocery store 2 years ago. In your mind, you're saying, Karen Sullivan, grocery store 2 years ago. We rehearse things a few times to actually get it into our memory. This is not working well when you are anxious, and it all goes back to this no room at the inn. We do not have any vacancies at this hotel, okay? We are already filled up with worry. So when you have no learning because you're not paying attention, you're not going to have a memory of it, okay? So one other way that I want you to start to think about why this is all happening, because remember, one of the symptoms is kind of mental restlessness. There's that inability to relax. Is really that, and we talked about this when we talked about trauma and a medical crisis, is so much of anxiety is an overstimulated nervous system that we don't have the ability, because of chronic stress, to ever come down off the ledge. We're constantly living up at an 8 or a 9 or a 10, and we have actually forgotten how to be at, let's just say, a 5, right? Or maybe be at a 5 and go up to an 8 but come back to a 5. So we've got this body that's kind of like got its finger in the socket, and we're just very, very, very keyed up. And we've got these distortions, the way that we're taking in information, seeing threat everywhere. And basically it's a vicious cycle back and forth between these two things that keeps us anxious. So in a minute, we're going to talk about what to do about all this, and it's going to have to do with calming down the body and changing the way that we think about information that's coming to us, and not presuming threat everywhere. Okay, so remember before I was talking about cognitive distortions? Well, these are really, really interesting to me. And I remember when I learned about them in graduate school, it was like a light went off and I realized, oh my gosh, I do this. I've heard my friends do this. I've heard people in my family do this. It is just a very, very common human way of staying secure and feeling like you're coping. But again, it's really probably digging us further into the hole. So what are these cognitive distortions? Well, they're really irrational thoughts that we accept as truth without any evidence at all. We fill in the blanks for ourselves. These patterns of thinking can be very, very subtle, very unconscious, but can be very damaging and have a very big effect on how we think that our life is going. So they can come in many different forms, but they really do all have a couple common threads. So the first one is that they tend to be really extreme, very black or white. Okay, things are either going to be a complete disaster or it's going to be amazing. Now, typically the complete disaster feels more comfortable to us when we're anxious. They are patterns that we really believe in. Like I said, we really do accept them as truth, but if they go unchecked, we are really doing ourselves some harm. So if you've studied psychology at all, you might have heard of something called cognitive behavioral therapy, and this was designed by a very famous psychologist, Aaron Beck, and he was really the one who taught us that distorted ways of thinking had a lot to do with difficulty in feeling. He really connected, this is why he developed cognitive behavioral therapy, because his thought it was that our thoughts really dictate our feelings and really add to psychological disorders. So there's another guy too, David Burns, who wrote a book called Feeling Good, the New Mood Therapy book. And I just wanted to mention those in case people want to follow up on that. So let's just go over a few of these. I'm actually going to post 2 links when we're done talking tonight that will have all of the cognitive distortions listed. And what I encourage you to do is print this out and start to realize, oh my gosh, I do this one, I do this one, I do this one. Okay, so the first one is catastrophizing, okay? And who has not been guilty of this? This is where we tell ourselves the very worst thing is going to happen. This is, getting on the plane and thinking for sure you're going down in flames. We also do something called overgeneralization, which is taking one experience from our past and feeling like that is going to replicate itself in the future and that it's going to be exactly, I've been down this road before. I know how these things work out, okay? Then we have emotional reasoning. We think that something is true in reality because it feels true to us emotionally. I just have a bad feeling about this. I just know how this is going to turn out, okay? Then we have something called mind reading, which is a favorite pastime of mine, where you like to think that you know what other people are thinking, that you know what their intentions were, and you don't check in with them because you kind of feel like your impressions are correct and you've got it all figured out. And the next one is superstitious thinking, which is really, really, really a tough one. And really the essence of psychological trauma is when everything that you've done, like I said my prayers or I try to be a good person, and then something stressful happens, like someone is assaulted or somebody gets robbed. Why would this happen to me? I'm a good person. I do good things in the world. I help other people. So really the unconscious belief there is that by doing and being good, that only good things should happen to us in return. And of course, so much of trauma is random and there's really nothing at all that the person could have done. There's also a certain personality type that is much more likely to be anxious, and this really comes down to 2 different things. The first one is a lot of difficulty sitting, being okay with ambiguity. Okay, so what I mean by this is the great unknown. Anxious people many times would rather feel like they can predict the future, even if it's very negative and stressful, because there's kind of this illusion of control when we tell ourselves, well, I know exactly how this is going to turn out. I'm not even going to get excited because I know I'm going to be disappointed, or I know for a fact this isn't going to work out, right? But what happens is it can kind of become a self-perpetuating prophecy, and negative things can happen because we kind of start to self-sabotage. The other thing is that anxious people tend to be perfectionistic, and if something can't be done perfect, they're actually not going to do it at all. Oftentimes, anxious ways of feeling and thinking are we absorb them through experiences with our families. People who had an anxious parent are 2 to 7 times more likely to develop an anxiety disorder themselves. And so what happens over time, of course, is that downward spiral of chronic tension and stress, because remember, the nervous system is on overdrive, and when you're so consumed with what's going to happen wrong next, you're really not in the present at all. What we're going to talk about is what to do about all these things, right? So I think that you will be thinking about anxiety a little bit different now, which is that it's not just that you're paying an emotional price, that things make you feel anxious, which is terrible feeling in your body, the sick stomach, the headache, all this stuff. But it's also maybe taking up precious space up here. So my thought is that when you understand more how these things affect you, you might be more motivated to make a change, or once and for all, maybe get some professional support that you've known you've needed for some time, but maybe just haven't really been able to follow through. So I want to talk a little bit about what is so important to be doing if some of this talk resonated with you. So that cognitive behavioral stuff I was talking about before, hands down, that has the most research support for anxiety. And really what it is a talented, well-trained, caring psychologist helping you understand where your thought patterns have kind of gone awry, but also helping you with some calming techniques, understanding how to relax, how to feel safe and relaxing when you have not been able to let your guard down for so long. Those two things are critical: checking your thinking and your expectation patterns and working on getting this body relaxed. I think that massage is tremendous for people with anxiety because so much of it is living in the body, that even with, a 60-minute massage, you then have 60 minutes of a totally different experience for your central nervous system, which, of course, in our peripheral nervous system, which ultimately is all channeled up to the brain. And so it's kind of this indirect way of being able to calm, get some of those stress hormones down, and it can really be powerful, safe, and respectful touch. It's very, very good idea to think about that if you are feeling anxious. The other thing, of course, is to watch your relationship with stimulants. The Mountain Dew, the Diet Coke, the coffee, those things amp up your nervous system even more. So what would be the worst thing for someone who's anxious is to have that cup of coffee first thing in the morning, no other food, no water, no nothing, and head on into work. Well, that's pretty much a recipe for complete anxious disaster. You have to really be mindful of, are you putting things into your body that are going to center you and calm you and make you feel grounded and in charge, which is kind of all this feeling, this energy, being centered? Or are you going to do things like sugar and caffeine that are going to basically just exacerbate your anxiety? Very important to prioritize sleep with anxiety. So much of what we do in sleep is psychological. It helps us to process trauma and emotionally difficult experiences. Like I always tell you guys, it's free therapy, but so many of us aren't really taking it serious. So if you've had ongoing issues with your sleep and it hasn't responded well to what we call sleep hygiene, which is, making sure you're avoiding caffeine, making sure that you're sleeping in a nice, cool bedroom, going to sleep at the same time, trying to wake up at the same time, maybe even trying a little bit of melatonin. If all those things haven't worked, you really do need to bring it to the attention of your doctor. I want you to do something I encouraged you to do 2 lectures ago, which is to really get better at responding to stress by saying, this is a challenge, not a threat, and I have the resources to meet this challenge. If you can start to think about potentially anxiety-provoking things that are happening around you in this way, just that change in your thought pattern, instead of being a threat, it becomes a challenge. Instead of telling yourself, oh my God, this is it, I can't do this, this is gonna be the thing that breaks me, oh my God, you know, forget it, call the ambulance, all of this kind of words and beliefs that you can't handle it, those things really do make you feel more anxious. So if you can just start telling yourself, hey, I've been through a lot, I can do this, I will keep continuing to meet these challenges. I wanted to end by talking a little bit more about those cognitive distortions, because what I'm going to do is post a link to like 10 or 11 of them, and I want you to print that out and start to realize, oh my goodness, this is what I'm doing. But I'm also going to give you a link to something called a thought record, which is basically a really nice guided worksheet, and it's an excellent tool for helping you identify the cognitive distortions, which, you know, they're so automatic and they're so unconscious that going through and making sure, you know, every couple hours you're filling out the sheet, it's going to be amazing to you what kind of self-talk you're maybe doing. So this worksheet is going to help you realize when you're actually having anxiety, what are the symptoms that you're having, and how your thoughts are related to the feeling of anxiety. And it's going to be very, very, very helpful. What I want you to do is write me a little post on here after you've done it for a day or 2 and just let me know about your experience. The first time I did it, we had to do it in grad school about negative self-talk when you made a mistake. You know, what were the things that actually go on in your mind? And I remember all of us in my class were so freaked out because the thoughts are so unbelievably mean. It's really like being a bully to your own self. You know, you idiot, why did you do that? You're always messing up. Oh, there you go again. And some people would believe that that's kind of an internalization of things that we've heard, you know, in our childhood from people that haven't treated us that well. But really our job as adults is to get into those thoughts and realize, man, that is causing me a lot of distress. And I don't want to keep living from that perspective. So the first step in making a change is simply tracking your behavior. So what we are going to do next week is talk about chronic pain in your body and what is it that you can do about it. Very important for so many of you, whether it's from aches and pains of aging, whether or not it's secondary to some kind of a neurological disorder. There really are some great recommendations out there for how to improve your quality of life, because chronic pain, man, it's the worst. It just drains you of a lot of emotional energy and a lot of physical energy. So I've had some nice training in pain psychology, and I want to teach you some things that I know next time. If you found this talk tonight to be helpful, really the nicest thing that people tell me about these talks is it makes them feel validated, that they feel understood. If it helps you be motivated to want to think and do things different, please let me know, because that's really the fuel that I need to keep doing these lectures and to, you know, really helps me focus the topics that we talk about. If you would like to share this video with any groups or on your wall, that would be awesome. The more people that we let know about this information, I really think that's how we're going to make our difference, you and me working together. So thank you guys so much, and I will see you again next Wednesday. Bye-bye.